Okay, so welcome to today's lecture, which is on the diseases of the immune system, so connected to the previous lecture, as well as my personal favorite to traumatize you all, which is the microbial diseases of the urinary and reproductive system. So that includes various sexually transmitted infections or diseases, which you hear as either STDs or STIs. So first, going into the diseases of the immune system, one of the big categories of diseases of the immune systems is actually hypersensitivity, which is a fancy way of saying allergic reactions. Now, people always say the term, allergies. Oh, I'm having an allergy. They don't realize that there are actually 4 different types of these reactions. Now, any of these reactions are going to be triggered by an allergen, which means that you have been sensitized by a previous exposure to an antigen. And an antigen is simply a protein receptor. So for instance, a part of the protein of pollen, or a part of the protein of even one of your own cells. And we're going to go through the various different reactions, but that's what we mean by antigen. And so if it's an antigen that's causing an allergic reaction, it's now called an allergen. And basically, your body gives an extreme reaction that it shouldn't be, to something that shouldn't bother it. Now, the 4 types of hypersensitivities, you can remember the order of them by this little trick over here, acid. The first type is anaphylactic. The second type is cytotoxic. Third is immune complex, and fourth is delayed cell-mediated. Now, I want you to circle each one of these and write a little reminder for yourself. So for anaphylactic, I want you to put the term pollen next to it to remind yourself that anaphylactic is the regular old allergies, kind of like you get from pollen. For cytotoxic, I want you to write the term cell surface antigen. So cyto, whenever you see that, that means cell. So remind yourself that cytotoxic is cell surface antigen and will include blood types. The third one is immune complex. And for that one, I want you to write immune complex is soluble or free-floating antigen. Okay, so free-floating antigen triggers the immune complex hypersensitivity. And for the last one, type 4, I want you to write poison ivy, delayed reaction. Okay, so type 4, remind yourself poison ivy, delayed reaction, and also remind yourself T cells, like the T cell immune system response that we talked about previously. Now, this slide is simply to give you an overview of each of the 4 reactions for hypersensitivity, but you don't have to memorize anything on this slide because now we're going to go one by one through each of the 4 types, and I'll go through what you should focus on for each one. So here we have the first one, type 1, which is anaphylactic reactions. And remember, you have to be able to identify if I say type 1 hypersensitivity, then right away you should know I mean anaphylactic reactions, which, like I said before, are your regular old allergies, basically meaning allergic reactions to things like pollen or a bee sting, cats, dogs, all of those are type 1 anaphylactic reactions. Now, this is a very quick reaction. So for instance, if you have an allergy to cats, the moment you're even near a room that has a cat, you start to feel the symptoms, things like scratchy throat or sniffling, congestion, dripping from your eyes, things like that. Now with anaphylactic reactions, okay, when you think of them, I want you to remember that IgE is involved in them, and basically you get a very high response of the mast cells and the basophils, which were previously mentioned regarding the immune system. So anytime you hear anaphylactic reactions or allergies, think mast cells and basophils. Those are the two immune cells that will be most active in this. And that's because these are the immune cells that trigger the things like histamine, leukotrienes, and prostaglandins. Now, with histamine, that we've mentioned previously, I want you to circle, star, highlight that word. You have to know that histamine is a vasodilator. Now, what do vasodilators do? They're going to increase blood flow, okay? They are going to give more of a volume for you to have with the blood flow, and that's important in any reaction because that's going to get immune cells to the location that's an issue. Now, with anaphylactic reactions, that's basically going to get more of these immune cells that are going to be triggering things that you don't want at that moment. Okay, because remember, this is a reaction that's not from, a bacteria or a virus. Instead, it's from something that shouldn't be bothering your body. Okay, your body shouldn't think of it as a bad guy. So you have histamine as a vasodilator, increasing blood flow. Then you have leukotrienes, and what leukotrienes do is they cause prolonged contraction of smooth muscles. So if you think about it, for instance, if you're having an asthmatic reaction to something like pollen or cats or whatnot, you have that feeling of your throat closing off. Well, that's due to the leukotrienes, okay, contracting those smooth muscles. You also have prostaglandins released in this reaction. They'll also affect smooth muscles, but the big thing I want you to remember for prostaglandins is that they increase mucus secretion. So if you think about if you have an allergy, I'm going to keep using the example of like cats or dogs. The moment they're in a room, you start going, well, that's because you have all of this extra mucus from the prostaglandin. So you're trying to clear your throat because you end up with so much of the mucus, and you get it in your nose as well, that excess secretion. Now, with any of the anaphylactic reactions, the type 1, they could either be local or systemic, two terms we talk about a lot in micro. So local means that they're basically focused at one area, one location on your body, or one organ system. So things like having hives or a hay fever reaction right up in your nose region, even something like asthma where it's focused on the respiratory, as opposed to a systemic reaction. And this is the dangerous one. If you have a systemic type 1 reaction, you are having anaphylactic shock. And if you've ever heard the term anaphylactic shock, you know that it's not just a little sniffling of an allergy. This can kill you. So basically what it triggers is possible circulatory collapse, and that will kill you. So it shuts down your circulatory and your respiratory system. Okay, and it happens very quick, so you have to be very careful and aware if someone has an allergy and it's going to trigger a systemic reaction. Here is a recap of some of the information that I put on that I spoke with the previous slide, because I know that that slide had a lot of information. Now, there are ways to try and prevent these type 1 anaphylactic reactions. There is the skin prick test and desensitization. So these are two different forms of prevention, because if any of you have ever had the skin prick test, well, it's not fun, but you know that the purpose of it is to determine what you are allergic to so that you can avoid it. So the skin prick test is prevention by avoiding what you now know are triggers or allergens for you. And the way they do that is that they will inoculate antigens right beneath the epidermis of your skin. They usually either do it on the arm like you see in this picture, or on your back, because that's a lot of surface area for them to test. And they look to see which one produces what we call a wheal, but that's spelled W-H-E-A-L. And a wheal is simply that red itchy bump that you see. So for instance, on this person, cat has quite a big wheal compared to the negative control or even pollen over here. Okay. So skin prick is to use the allergens under your skin, see whether or not you get a response so you know what to avoid. Now, desensitization, on the other hand, is prevention by actually trying to treat the allergy. So basically trying to desensitize you. So what they do is they give increasing dosages of the known antigen to you. They inject it beneath the skin and they try and trigger the production of IgG, which will act as a blocking antibody to try and block those allergens and neutralize them. Okay. Now, desensitization is very, very dangerous to do because even though sometimes it does work and can help people, you do run the risk of triggering anaphylactic shock, okay, the systemic reaction, if the person has a bad enough allergy or if you are not as experienced with controlling the levels of dosing. So you got to be careful with these types of prevention. Then we have type 2, which is the cytotoxic reactions. Remember, I want you to write, anytime you see cytotoxic or type 2, I want you to write cell surface. These are cell surface antigens. And basically what can happen is there are antibodies produced against these cell surface proteins. Okay, now with cytotoxic reactions, again, it's the idea of the cell surface proteins that are triggering the reaction, okay? And with this is how you get blood typing, but also the issue in terms of pregnancy complications or donor problems, okay? So now, two different things. The first one that I mentioned is pregnancy complications. So when you have the pregnancy complications, what you will notice is sometimes a woman will be pregnant with a baby that has a different cell surface antigen than her own blood cell surface antigen. So we call that the Rh factor antigen. So sometimes the baby will be Rh positive, meaning it has this extra protein antigen, whereas the mother is negative. Now, during that actual first pregnancy, it's usually not a problem. The problem arises when during the delivery process, you now get a mixture of those antigens and those blood cells. And so now the mother is exposed to possibly the baby's Rh factor. And so the mother's body detects that as a foreign intruder and produces antibodies against it. Now, it's not a problem for that baby because we just said it's during delivery. So the baby is out. So it doesn't matter that she has these antibodies against that Rh factor. The problem then arises with the second pregnancy because now that baby is in there with a mom who has antibodies against its own proteins. Okay, so if there's ever any exposure that occurs during that pregnancy, then the mom's antibodies will try to attack the baby. Now, thankfully, they do now recognize this kind of event and they're more careful of it. They do testing beforehand and they can give treatment during the pregnancy to try and kind of stifle those antibody reactions and try and protect the baby from this kind of reaction. Now, speaking of blood antigens and you know, the Rh factor, separate from that, the actual blood typing is based on cytotoxic reactions. You know, it's based on cell surface antigens. And so, especially in the medical field, this is where knowing each patient and even knowing your own blood type is so significant, because if you get a transfer of blood from someone else versus if you also donate blood to someone else, you then have to be very careful not to trigger a cytotoxic reaction in this person. So now when we talk about blood typing, you always have to ask yourself, what is your blood type? You know, what is the name tag antigen of your blood versus what then will be the antibodies floating around in your body because they don't recognize the other blood types as their own, as foreign invader. So to make this a little clearer, I have the chart on this, the chart or table on this figure. So you have to be very comfortable with blood typing, okay? So normally you don't have to memorize or know the figures, but this slide is very important. You have to know blood typing and know when a reaction will occur. So if you are blood type A, that means that your name tag, your body, should recognize any blood that just has A on it, right? Your antigen on your blood cells, your name tags are A. So now, if your own antigen is A, then what's your body going to consider a foreign invader? Well, that would be the other possible antigen, which is B. So your body would have antibodies against B and attack anything that has any sort of B antigen, okay? Whereas it recognizes A as its own. Let me not attack that. So then if you have blood type B, it's the opposite situation. Your name tag is B, okay? Your antigen on your own blood cells is B, and your body will recognize anything that's B and then say anything else that is A is a foreign invader. Let's attack it. Now you're lucky if you have AB blood, right? Because then you have A and B antigens. So your body doesn't think anything's a foreign invader. If it sees A blood type, well, I have A, that looks just like me. If it sees B, well, I have B cells also. I have the B antigens also. So that looks just like me. So I'm not going to attack anything because they all look chill to me. They look just like me. Okay, so they won't have any antibodies against anything because they have all of the possible antigens. Now, unfortunately, if you have O blood type, you don't have A or B antigens, which means your body will attack any A or B that it encounters, okay, because it sees those as foreign invaders. So you have to be very comfortable with which donations, which receiving blood types will be a problem. So for instance, if you have a patient that is type A blood, and I can then ask which of the following will cause a dangerous reaction, or which of the following will cause a cytotoxic reaction. Same thing, okay? Which means in which case will the body fight the blood that you're giving it. So if your patient is type A, what blood will it fight? Well, it'll fight type B because it sees that as a foreign invader. And it'll also fight type AB because it looks at the B within AB as a foreign invader as well. Okay, so if you give it A blood, it'll be fine. Also, if you give them O blood, they'll be fine. Why is that? O is the universal donor. It doesn't have any name tag that the recipient would recognize as something bad. Okay, AB on the other hand, if you're AB, then you are the universal recipient. You could get any of the others. If you try and give someone with AB type A blood, that patient's going to be like, yeah, A, I have that in my blood, looks just like me. B, I have that in my blood, looks just like me. O, there's no antigen on it, so it doesn't even recognize that as a foreign invader. So they could get anything, but who can they give to? Only other AB people. Because if you try and give AB blood to someone who's type A, the B will cause a problem. If you give AB blood to someone who is type B, what will cause the problem? The A blood. And if you give someone type O, anything other than O, their body's going to go crazy because they recognize that as foreign invaders. Okay, so I'm going to put one more example on the next slide just so you have an example in writing. For you to send me and remind. And then also if you want further practice, just ask me for more practice problems with blood typing and cytotoxic reactions, and I'll send you those in remind as well. Okay, so here is the question I would like you to send me the answer to in remind. Now, what's interesting is cytotoxic reactions or cell surface reactions can also be drug-induced allergies. Okay, so if you suddenly have an allergy to a drug such as ibuprofen, which a lot of people are finding now to be a problem, we call that a cytotoxic reaction. And it's specifically because the drug serves as a hapten, and I want you to know that definition. So the hapten is basically a small molecule that will stick to a larger cell or a larger carrier to trigger a reaction. So in this case, the drug, such as, I'll use that same example, ibuprofen, will now stick to your own platelets, and now that drug has become a cell surface antigen. So your body will no longer recognize any of those platelets that are now coated with that drug. They think that they're a foreign invader, and they'll start attacking your own cells, and that can cause a big problem. I put the examples on the side: thrombocytopenic purpura, granulocytosis, sorry, I mess that one up all the time, and hemolytic anemia. Now with any of these, basically they are all examples of cytotoxic reactions. You don't have to memorize the names of these, just be aware that drugs can be haptens in a cytotoxic reaction and what that actually means. And so if you have a patient who's suddenly looking a bit anemic, keep in mind that even their own medications that you have given them can trigger that, okay? Okay, so now we have type 3 hypersensitivity, which is immune complex reactions. And like I said, whenever you hear type 3 or immune complex, think soluble antigens, which is a fancy way of saying free floating antigens. They are no longer on the surface of a cell. Now, with this reaction, usually what happens is you've had an excess of an antigen in a previous infection, and that led to these small, basically the antigens floating around, and that leads to this small collection of immune complexes that are basically sticking to the antigen. And once you now have that antigen with a whole bunch of antibodies stuck to it, that complex can end up lodged in some of your tissues or membranes or organs. And one of the areas that we see this happen a lot is the kidneys. And you end up with this immune complex getting stuck in the kidneys, and any immune complex then triggers things like inflammation, which can cause a lot of damage. And we call that glomerulonephritis. Okay, so remember, glomerulonephritis is the example of a type 3 immune complex in which these immune complexes of antibodies and antigen have gotten lodged in the kidneys. Okay, but they can end up lodged anywhere, and wherever they end up lodged will cause a problem. Now, the fourth type of hypersensitivity is delayed cell-mediated reactions. And when you hear in the immune system cell-mediated or cellular reactions, well, that right away should tell you that T cells are involved. It's your adaptive immune system. And that's why it is a delayed hypersensitivity. And on this slide, I want you to circle poison ivy and contact dermatitis, because those are the examples of delayed cell-mediated reactions. And you'll notice that someone who is exposed to poison ivy, you're not going to instantly break out the second that you walk by that poison ivy or that you touch that poison ivy. Instead, it'll be many days later that it suddenly pops up. And the reason for that is because this is T cell mediated. And as you saw in the immune system lecture, T cell mediated reactions take time, right? There's all of that activating and differentiating, and helper T cells activate this guy and differentiate this guy into this cell, and all of this chain of events, and that takes time. So that's why type 4 takes a longer time, whereas something like type 1, as soon as you're exposed to the pollen or the cat, you're instantly feeling it. Now, in addition to the hypersensitivities, which are caused by foreign antigens entering your body, now instead there are also autoimmune diseases. And in autoimmune diseases, your body has now lost its self-tolerance, okay? It can't tolerate itself. And now for some of you, I understand if you can't tolerate you, but it's kind of a sad reaction because your body basically turns against you. And this loss of self-tolerance means that your body loses the ability to distinguish self from non-self. So it starts attacking your own cells or your own organs because it sees those antigens as foreign antigens, okay? And it can do a lot of damage to you. Now, they're still studying, and each autoimmune disease is different, so there's many different possible causes. Some are genetic, some are environmentally triggered. They're even finding things like certain medications or infections can cause them. But no matter what's the cause, these are kind of brutal diseases because it's your own body no longer recognizing itself. Now, there are three categories that you'll actually recognize this terminology from hypersensitivity as well. So the three types of autoimmune reactions are also cytotoxic, immune complex, and cell-mediated. We just leave out type 1 from the hypersensitivities. And the way that these reactions occur will be very similar to what we just talked about. So cytotoxic will again be triggered by cell surface antigens. But now, unlike in hypersensitivity, where these were outside cell surface antigens, for instance, donating or getting someone's donated blood added into your body, now in cytotoxic autoimmune reactions, it's your own cell surface antigens that your body suddenly is fighting or attacking. And examples include Graves' disease and myasthenia gravis. In immune complex, just like we talked about in hypersensitivity, you again have free-floating antigens, and you again have these complexes of antibodies and antigens depositing themselves into your tissues. But again, now the only difference is it's not something from outside, but it is your own antigens free-floating that are causing the problem. And out of all of the terms on this slide, the one I want you to really remember and circle, star highlight, is rheumatoid arthritis. That's why out of all of the examples, it's the only one that has been colored in, because I want you to remember that when you see rheumatoid arthritis or you hear that term, think autoimmune. And the reason why I emphasize that is so many people, when they hear arthritis, what do they think of? They think of the elderly. They think of someone who's having trouble, closing their hand or grabbing a hold of things. And they don't think of something very severe. But rheumatoid arthritis can strike the young even. So someone in their 20s can suffer from rheumatoid arthritis because it's autoimmune. It's not from age. And what happens is those immune complexes that you saw in hypersensitivity embedding in the kidney, well, now in rheumatoid arthritis, immune complexes, they get stuck in the joints. And not only do you end up with major inflammation and pain and issues there, but gradually the joints end up losing all mobility and they start fusing together. And you end up even having organ portions fusing in the body. And ultimately, rheumatoid arthritis can lead to death because this is not just regular old arthritis. So I do want you to keep in mind when you hear rheumatoid arthritis, think autoimmune. And then the last example of a category that we have on this page is the cell-mediated reaction, which just like in hypersensitivity, this is mediated by T cells, so it will be delayed, but again, it's now attacking your own tissues and your own cells are triggering it. So things like diabetes type 1 or even psoriasis are autoimmune diseases that are cell-mediated. Now, everyone nowadays thinks of autoimmune diseases, but they don't really think of the opposite problem, and you don't tend to see the opposite problem as much, which is immunodeficiencies. So in autoimmune diseases, your immune system is overly active. It is so extra, okay? But with immunodeficiencies, now you're actually missing parts of your immune response. And this could be very problematic and dangerous. So there are two types. Immunodeficiency can either be congenital or acquired, and congenital will also be called primary immunodeficiencies. And the difference here between congenital and acquired is congenital is from birth. Okay, so from birth, these people will be missing the ability to make certain immune cells or have a certain aspect of their immune system, whereas acquired immunodeficiencies are developed later in life, usually due to things like drugs, cancers, or infections. And there is a big old famous one, which everyone usually knows right away as AIDS, acquired immune deficiency syndrome, okay, from the infection HIV. So we'll talk about that more in an upcoming slide, but keep in mind the difference between congenital and acquired immunodeficiencies. Now, the big thing I want you to know when it comes to immunodeficiencies, especially the primary immunodeficiencies, is the difference between what will happen to a person depending on which type of deficiency they have. So if they have B cell defects, okay, defects there will cause problems in the humoral response. Because remember, anytime you hear B cells, you have to think production of antibodies, and that's the humoral response. But it won't affect as much the T cell response. Whereas T cell defects, if someone does not have T cells or proper T cell function, well, now they lack both the cellular and the humoral immune response. Why is that? Because if you remember from the previous lectures, the humoral response is based on helper T cells activating the B cells. Okay, you don't get B cell activation without helper T cells. So if a person is missing T cells, they lose both their cellular response and their humoral response. Now, in addition to those that are from birth, those primary immunodeficiencies, someone can also develop acquired. And the big example I want you to know, of course, is AIDS. Understand that it is caused by HIV, human immunodeficiency virus. And when we talk about HIV, there are a few things I want you to always remember. First off, the way that HIV will infect you or infect your cells is due to glycoproteins that will basically bind to various cells in your body, such as T cells, and that will ultimately create this big clump of infected cells called a syncytia. And if those T cells and macrophages, all these immune cells, are now stuck together in clumps, they can't do their job to protect you. And a lot of times your body will then try to destroy those syncytia, and so your body ends up having to destroy their own immune cells. And now the way that they are infecting these cells is through receptors, and some people naturally have mutated or differently shaped receptors, and so they are immune to HIV, and we call that CCR5 immunity. So if you see the receptor over here is called CCR5, usually that HIV is using. Now, the big thing I want you to remember about HIV is that it has an RNA genome. Specifically, it is reliant on reverse transcriptase. And with that, I want you to remember that that creates a big problem for us trying to solve, the issue of HIV, because reverse transcriptase makes a whole bunch of errors when it is trying to make a DNA copy in the host of that virus's RNA genome. Okay, so transcription is going from DNA to RNA. So if you hear reverse transcription, it means that the virus has an RNA genome that once it's inside of the host, it will it'll use reverse transcriptase to make a DNA copy of its viral genome, and it will integrate that into your own DNA, okay, into the host genome. Now the problem is reverse transcriptase is really crappy at its job. It makes a lot of mistakes, okay, just like undergrads do. It makes a lot of mistakes when it is trying to turn that RNA into a DNA code. And so these mistakes in the DNA code we call mutations. So when you have HIV, the genome of that virus is constantly changing because there are so many mutations that build up, which makes it very hard for us to target, to recognize, or to handle. But now they have found ways around that and try targeting other aspects of the virus. This is just to show you that there are latent and active HIV viral infections. And so sometimes the virus will be dormant as it's integrating into the host DNA, and it won't be producing extra proteins or new viruses, but then it will activate. And I just want to point out that usually when you have a virus latent in your body, there are 2 times when it tends to become active. One is when you are immunocompromised, and the other is when you are under a lot of stress. And this will come back at the end of the lecture when we talk about STDs. This is just a figure to show you the progression of HIV and showing you basically how the T cell count will keep plummeting and plummeting until you reach the category of being fully immunodeficient, and then you will be categorized as having AIDS. Now, I want to point out that HIV is still not curable, and you will basically hear on the news some cases like, oh, these 1 or 2 people have been cured. But if you actually look into that research, they are only able to do that technique on basically people who are already fighting something such as terminal cancer or whatnot, where basically the procedure to do is so brutal, so dangerous, and more likely to kill the person anyway, that they can't do this as a viable, healthy option because they basically have to completely kill that person's immune system. And as you know, you need an immune system, so you don't want something that's going to destroy that. But like I was saying, there's no cure, but ultimately HIV has become very treatable now. Things like cell entry inhibitors, reverse transcriptase inhibitors, or antiretroviral therapies. So basically, they have trouble targeting the virus because it's constantly mutating. But if you can kind of help block its entry into the cells or block the enzymes that it needs to create more viruses, then you can kind of keep the levels rather low in the body to almost non-detectable levels. So now that's it in terms of the immune diseases. Now I want to switch over to the microbial diseases of urinary and reproductive systems, which, like I said, is one of my favorite lessons because it is so traumatizing to students, and because unfortunately not enough people, whether they're young students, whether they're older grown-ups, they do not truly understand a lot of the aspects of sexually transmitted infections. So this is a very, very important lesson, not just for you, but for any of your patients as well, because like I said, there's so much misinformation in this area. Now, before we go into the sexually transmitted infections, first let's talk about the urinary tract infections. So when you think of urine, I know you don't want to think of urine, but when you do, it's essentially going to be sterile. So if they detect any bacteria or microbes in a urine sample, that is usually an indication of a UTI. Now, unfortunately, you're going to see that a lot of the urinary tract infections and the reproductive system infections tend to be more common in women. So when it comes to UTIs, why do you think they're more common in women? 2 reasons. One, the female urethra is a lot shorter than the male. Okay, and refrain from any jokes there, but it is shorter than the male because, again, if you think of the internal system versus the outwardly extended system of the male, not drawing any pictures here, but still, shorter urethra. And secondly, because of its shorter location and internal location, it ends up that the urethra in women is very close to their anus, which, if you think about it, again, I know you don't want to think about it, but if you do, that location is going to end up with a lot of fecal bacteria, kind of like when we talked about water contamination. Anytime that you have fecal material present, there's going to be things like E. coli or other coliforms and whatnot in that area. So having the female urethra so close to that fecal material ends up causing a lot of infections. Now, when we talk about urinary tract infections, there are 4 main ones to think of. You can have urethritis, cystitis, nephritis, or prostatitis. For each of these, I want you to know what is actually getting infected and inflamed. So in urethritis, just like it sounds, that is the urethra has been infected. In cystitis, it is the bladder that is infected. So that's the tricky one usually, so I tend to like to ask about that one, the bladder for cystitis. Nephritis, so kidneys or nephritis. And prostatitis, of course, is the prostate, which will only be in males. Now, the good thing about UTIs is they're usually very treatable with antibiotics. Now, this is just to show you a little bit of a breakdown, some of the pathogens that will cause it, but again, you do not have to memorize anything on this particular slide. So now we get to the fun part of this lesson, which are the reproductive system infections. Okay, so now we're going to be talking about sexually transmitted infections, also known as sexually transmitted diseases or STDs. Now, unfortunately, this is another area where women tend to be more affected by these kinds of infections. The reasons are a little different from UTIs. So the reasons why women are more infected by STDs: first, the vaginal lining is a lot thinner and more delicate than the male penis lining and tissues. Okay, so the vaginal lining is thinner and more delicate. Secondly, and I'm sorry, students hate when I phrase it this way, but the female region is a lot moister than the skin of the penis. So if you think about it, the female area, there's high moisture and warmth, which is basically what microbes love. Think of an incubator. Think of when things spoil. It's usually moisture and heat. Now, unfortunately, the other issue that women end up having with STDs compared to males is that for women, they're less likely to notice or complain or go to a doctor with these symptoms, because for many women, if you feel discomfort down there, okay, you're so used to having menstrual issues every month that, a little pain, a little discomfort, you just kind of shrug it off. Whereas for men, the moment there is any pain or issue with their penis, I guarantee you they are going to call someone because they will freak out. Whereas women, it's kind of a common thing that they realize too late what's going on. Now, when we talk about STDs, they can be not just from bacteria, but they can be from any of the microbes. So bacteria, viruses, fungi, or parasites. And one of the biggest issues is that a lot of the STDs, especially in women, do not have signs or symptoms, especially in the earlier portion of infection. But unlike what most people think, you can get an STD from someone who is not showing any symptoms. For instance, you can get herpes from someone who does not have a mouth or genital sore obviously present. Okay, so people can be asymptomatic, and meaning they're not showing any symptoms, but you can still get an STD from them. And so the other big problem with STDs is that a lot of people don't realize that you can get them when you're in a monogamous relationship. Okay, so why can someone get an STD, or how can someone get an STD in a monogamous relationship? Well, one, even though you're with one person only at that time, Well, one, everybody cheats and lies, but two, a lot of these infections, they stay with you for life. They go latent. So even though you and your partner may be honest and monogamous at this point, you may even be married, you do not know all of the partners they had in the past. They may have picked something up from those previous partners. They may be asymptomatic, and that virus or that infection is sitting in their body where they are able to transmit it to you. And one of the ELISA lab experiments we like to do with students shows that as well, where someone can be married, have children at this point, gets a call from an ex, and it turns out they have HIV. So these things can be very problematic. Now, yes, some of them can be treated with antibiotics or antivirals, but like I said, even with treatment, sometimes the treatment will kind of stop the current symptoms, but you are still stuck with a lot of them for life, and they can pop up later on down the line. And they're finding more and more causing issues down the line, including cancer that ends up killing people. So you wouldn't think that people die from STDs, but it's actually becoming some of the biggest cases of cancer and death are thanks to sexually transmitted infections. Now, the last point I want to make is, why are these sexually transmitted diseases so rampant and so difficult to control? And there are a few answers that I want you to remember. The first reason they're so rampant now is, first of all, a lack of proper sex education. You know, a lot of the youth and even adults are not realizing that kissing, oral sex, fingering, and anal sex can all allow you to catch or spread STDs, meaning that giving or receiving any of these things, not just regular old penetrative sex, can cause STDs. One of the big ones that people don't realize, again, is oral sex. You know, for instance, giving or getting these kind of oral sex activities can end up causing infection. So a lot of people don't realize that. The way I always phrase it is, think of it this way. To a pathogen, a hole is a hole. So a pathogen will never look at a mouth, let's say during oral sex, and say, oh my God, that's a mouth, so disgusting, I will only go for a penis or a vagina. No, a hole is a hole, and both have, you know, the warmth and the moisture conditions that the bacteria or viruses love. Okay, or fungi as well. So we'll talk more in detail in the later slides. One of the other reasons that the STDs are so rampant and problematic, I already mentioned the fact that not all people show symptoms. A lot of people will be asymptomatic when they spread the infection, so you won't even realize that you are picking up an infection. There's also the societal pressures. So the fact that we live in a hookup culture now of great access. So things like dating apps, social media, the internet, bars and clubs, all of that. You know, the world is a much smaller place now, and it's a lot easier to meet people. And along those lines, the increased density and mobility of the human population as well is part of the problem. Okay, so make sure you know some of the reasons why STDs are so rampant now and difficult to control. So now we're going to go through some of the examples of STDs. The first examples will be bacteria. So the first guy is quite famous, syphilis. This you used to hear of a lot more, but it does still exist, especially in certain groups. And with syphilis, first off, I want you to remember that it is caused by a spirochete. So treponema is an example of a spirochete, and it means it will be using axial filaments. Make sure to write axial filaments to embed itself in the person that it's infecting. Now, syphilis can either be through horizontal or vertical spread, which you're going to see for quite a few of the infections with STDs. Horizontal, like the horizontal mambo, is sex. So horizontal transmission is spread through sex, whereas vertical transmission, I always tell students, picture a pregnant woman standing up and boom, the baby just plops right out. Okay, so vertical spread is from mother to fetus, so it's transplacental. So make sure that you are very aware of horizontal versus vertical. And vertical is very sad because this transmission a lot of times will cause intrauterine death or birth defects. And basically, if the baby does end up born, it may end up having a couple years down the line major facial or tooth deformities from the infection. The other sad thing about syphilis is that it has 3 stages. So the initial stages kind of may just look like nodules or even flu-like symptoms. Even in secondary syphilis, the secondary stage, that's when it's kind of like having the flu. But then the problem is it goes latent, and especially if it hasn't been treated, it goes latent and then pops back up, like a lot of things that go latent, in the nervous system and neurologically. And so this is where you end up getting people back in the day, especially, who had that syphilis psychosis where it went to the brain and it just made them crazy. Okay, and the other thing I want to point out, syphilis, you'll see gummas whenever you hear that term or see that term. It's these horrible, horrible lesions across the body. Then we have the example of gonorrhea. And this is one of my favorite stories because most people hear gonorrhea as called the clap. And the reason why it has that nickname, there's a few different reasons. One is the normal, kind of not sounding so bad reason, which is that brothels back in the day used to be called clapiers, French term, and clapier then became, the idea most people were getting the infection from a brothel, so call it the clap. The other reason that always traumatizes the students, especially when we have boys in the class, is the clap also came from an old-time treatment where if you picture, a male would go in with this infection, and as you can see, there's, pus and discharge involved in this infection. And so the doctors used to think that, hey, maybe if we get that pus out, we'll free the person from infection. So what they used to do is take the male's penis, place it on, let's say, the desk or the medical table, and take something very solid and weighted, such as a textbook type of a medical book, and clap it against the penis to try and expel all of that pus and infection. Now, as you all know now, that does not actually work. It's an infection, it's bacterial, so antibiotics actually are the way to go. But unfortunately, they didn't have that back then, so they tried good old-fashioned clapping. Okay, so think of that anytime you say the word clap, or if you ever have to clap at a performance. Okay, now when we talk about the clap or gonorrhea, it's caused by a gram-negative coccus. So if you did a gram stain of it, what would it look like? Usually round and pink cells, and it's usually diplococcal, so you'll see 2 circles together. Now, like many of the infections, it does not survive well outside of the host, which is why it's a sexually transmitted disease, because it needs that close contact. The other thing with this is that it tends to be asymptomatic, especially in women. So a lot of times guys would catch this infection not knowing that the female was a carrier. And with this, just like with syphilis, transmission does not have to be from sex, which would be horizontal transmission. It can also be vertical. And this creates 2 big problems for women. And I want you to know both of these problems. The vertical transmission of gonorrhea causes, 1, eye infections in babies. So when they're born, if you see them putting the eye drops, the antibiotic drops, that's, just in case the mom does have such an infection. And the other problem is, unfortunately, infertility issues. And you're going to see this in the next slide as well. So with this, when you think of gonorrhea, the idea is there are a lot of virulence factors. And so this is not only the pathogenicity, but that infertility issue is because of the damage done with some of the factors and the toxins and the damage to the epithelial cells in that body. Okay, now gonorrhea, when you look at the virulence factors, you'll notice that a lot of them are for adhesion, and that's important because if you're thinking of where this infection is, so for instance, penis or vagina, there's a lot of urine and discharge in those locations, so any infection there has to be able to resist getting washed away. So that's why there's a lot of adhesion factors, and there are also things that are kind of helping promote the rapid spread and kind of blocking the immune system from really being able to fight this kind of infection. The next infection I want to mention is one of the most common infections around, which is chlamydia. And with chlamydia, yes, you can treat it with antibiotics like doxy or azithromycin, but the big problem with chlamydia is the same issue we just mentioned with gonorrhea, that unfortunately, this is one of those things that can cause problems throughout life, especially for women. So you may be thinking that, oh, I'm young, I could do whatever I want, I'm young, I could, it's normal for me to go all these places, do all these things, not, really think about who or what I'm doing things with, and then not realize down the line that it can cause a problem. And the two big problems with this STD, again, are one, causing conjunctivitis in the babies if you are pregnant and have this infection. So during the birthing process, it ends up transferring to the baby as conjunctivitis or an eye infection. And the other thing is the idea of infertility, because this infection causes major scarring and tissue damage in that area that you won't notice. So yes, you may have treated it with an antibiotic and feel all better, but major scarring has occurred. And if you think about it, that then makes it harder for implantation of the egg and development of a fetus. Okay, and it's kind of funny because I tell the story about how I was watching the news with my grandmother, and older people, the way they think or say things out loud, old-fashioned thinking. It was a story on how much infertility there is nowadays, and how many women have to fight so hard and spend so much money and still at the end of the day not end up with the baby that they so badly want to have in their life. And my Nana just stops and looks at me and she goes, because all these girls, it's all that sex before marriage. And the funny part is she didn't realize that in a way she was right, because of all the girls that and guys nowadays that are so careless with their sexual activities and don't think about the consequences. Because again, they think STDs all just take an antibiotic for that. Everyone has them, it's no problem, doesn't really do anything. Well, it does do damage that you can't see, that's within your body and stays with you for life. And so a lot of these women unfortunately end up infertile because of the scarring and the damage that's been done inside their body, and they caught it from someone that didn't even have symptoms, so they didn't realize that they were walking around with an STD because the person that they caught it from didn't show any symptoms. So please be very careful with these things, and make sure your patients are as well if you go into the medical field. So here you have another lovely gram-negative bacterial infection that is sexually transmitted, usually causing very painful soft ulcers, so ulcers that we call chancroid or soft canker issues over here. Now this is, chancroid is a little bit different from some of the other sores in that chancroid sores are very, very painful. Like I mentioned, it is gram-negative, so they're able to do smears of the aspirates from that they obtain in the medical office. So they suction out basically particles from this infection. So think of, let's say, if there's discharge or whatnot, or even suctioning out some of the, let's call it the yuck from that sore, and then they culture it and do the gram stain. And if it's, visualize, it'll basically look like gram-negative rods that are in this chain of what they call a school of fish appearance. So I want you to circle gram stain and write school of fish appearance. So if I mention, or if I ask on the exam, which of the following infections is kind of associated with a school of fish appearance, that would be chancroid. Okay. Now again, just like some of the other ones, there are treatments provided that will help with these kinds of symptoms. Sometimes chancroid that we just talked about on the previous slide is mixed up with what's called dana venosus. And dana venosus is caused also by a gram-negative rod, but this one is Klebsiella. So whenever you see Klebsiella, I want you to remember that that is what's causing dana venosus. Okay, so fair game for me to ask. Klebsiella is causing dana venosus, and this one creates also these crazy nodules on the genital region that then end up kind of breaking down to form these ulcers with a lot of bleeding in them as well. And unfortunately, when you have these kinds of ulcers, anytime you have ulcers in the body, you're then prone to secondary infections. So a lot of times people with dana venosus have to be very careful of secondary infections. And when you see the word granuloma or granulomatous, basically that tells you that the ulcer has clumps of tissues around that inflamed wound area. Now, just like with some of the other ones, you're able to treat with antibiotics, and the two big ones for treating STDs tend to be doxycycline and azithromycin. Now, all of those examples that we just went through are bacterial, but I do want to give you some of the viral infections as well that are STDs. The first one is one of the most famous, so everybody knows herpes, but there are some things that you may not know about herpes or you may not realize. So first off, when you think of herpes, there are actually two different forms. There's herpes simplex 2 and herpes simplex 1. And it's funny because back in the day, it used to be that herpes simplex 1 was the infection that you found in the mouth region, so mouth sores, whereas herpes simplex 2 was where you found in the genital region. Okay, so think HSV1 mouth, HSV2 genital. Now, funny enough, nowadays, both are associated with both locations. So you find HSV1 and 2 on the mouth and on the genitals. I won't flat out say why that is, but I think you know why that is. Okay. I also do want to note that when it comes to these two, as much as I mentioned, oral sex and all of that, these are not just sexually transmitted. So this is viral infections that are in saliva. So even a lot of children, unfortunately, pick up herpes from relatives because the relatives will share drinks. So for instance, sharing a straw or the cup will then transfer the saliva to the child, or even kissing a child on the mouth the way, relatives sometimes do, just a quick peck on the mouth and not thinking of all of the infections that they have, that are transmittable. So even though we do say these are sexually transmitted, please keep in mind, you can accidentally transmit them to anyone regardless of age and not just through sex. Now, when we talk about herpes, one of the big things students tend to always know is you are stuck with it for life. Okay, so unfortunately, herpes ends up going dormant in the nerves and then will reactivate. And because it's going dormant in the nerves, the reactivation can be quite painful, those blisters and whatnot. And like I said before, anything that is latent, when are the two times that they tend to reactivate? One is during stress, one is when you are immunocompromised. Make sure you remember that. And when they come back, it's usually more painful and problematic because they've been now in the nerve cells that they're emerging from. Also keep in mind, like I mentioned earlier, this can be spread without showing symptoms. You can get herpes on your mouth or your genital region from someone who does not even have sores. So please be careful about sexual practices, and also be informing your patients as well, because a lot of patients do not realize these things. What's crazy about genital herpes is that the amount of people that have it is crazy high. Global estimates are more than 75% of the population has it, and most don't even realize it, so they end up spreading it to more people. And estimates are at nearly 800,000 newly infected Americans a year. So please try not to be one of those newly affected, because they are finding that a lot of these infections, especially the viral ones that go latent, do lead to issues down the line, including cancer. So don't take these things lightly. Speaking of cancer is the big bad one that you hear of nowadays, HPV, human papillomavirus. Now, this is what causes things like genital warts, and if you think of warts that uncontrolled, so uncontrolled cellular growth outward, if a virus is able of causing those, then it makes a special sense that it will also be able to cause the uncontrolled cell growth of tumors and cancers. I want you, anytime you think of HPV, to realize that it is now not only the leading cause of cervical cancer, so know that one. It is the leading cause of cervical cancer, but also now the leading cause of rectal cancer and throat cancer. Okay, big time cause of throat cancer. In fact, usually if someone presents with throat cancer, 99.9% of the time, it is usually nowadays HPV causing it. And unfortunately, with these kinds of patients, if they have cancer caused by HPV, let's say you have a female patient who comes to you with cervical cancer, you treat that and you're so happy that she's in remission for the cervical cancer. Unfortunately, a lot of times within 6 months or a year later, pops up throat cancer as well, and it's killing a lot of women. And the really, really sad part about this is a lot of these women, especially who are dying, even though men can as well, a lot of the women who are dying didn't even know that they had an STD, and they didn't realize that they got this because their husband was cheating on them. So it's really sad, the number of stories that you see that these women were in monogamous relationships, doing everything right, faithful, thought that just because they're with one person at this moment, married, safe, secure, they thought that they were fine. They didn't have to worry about, STDs, because they think that's for young, partying kids. And it's like, no, unfortunately, they didn't know that their partner was cheating on them. They picked up this virus, and down the line it caused cancer, and a lot of them end up dying, unfortunately, because the cervical cancer and the throat cancer especially are very aggressive, and the rectal cancer. Even you see a lot of celebrities facing these issues as well. So please be very careful when it comes to HPV. It is skyrocketing, the number of people who have it. And like I said, a lot of them do not show symptoms. So especially the males tend not to show the symptoms as much, unless down the line they then get the throat cancer issue from it. Now, there has been a vaccine developed. Initially, they had you do 3 doses of it, so you would go back every few months to get another dose of it. But now they're showing that even just 1 dose alone seems to be enough to prevent getting HPV. And you are able to get it at any age. They used to only give it to younger people because they figured these are the people who have not had sexual encounters yet. But now they're letting even adults get it, just to try and help minimize that risk. Because if you haven't been exposed to HPV yet, you do want to be protected, or more protected from it. And keep in mind, when it comes to HPV, you can only treat the symptoms that you're seeing. So for instance, cryotherapy or drugs to remove the warts, but you will not get rid of the infection, because it tends to go latent in the body and then cause the cancer down the line. Now, seeing as I've ruined all kinds of sex for you, why not ruin kissing too? Along the lines of HPV, there is also EBV, which is Epstein-Barr virus. This is the one that most people know as mono, and very common, especially in college students. And a lot of people take it for granted because they're like, oh, it's just kissing disease. Everybody gets it. It's transmitted in the saliva. It's actually an example of a herpes virus, so different from the ones that we just discussed. The fact that it's a herpes virus tells you that it has a DNA genome that we've talked about previously. And when you think about mono, a lot of people think of, again, kissing disease, college campuses, things like that. As you probably know, this is one of the ones that there's no cure, no vaccine. You are stuck with it for life because it is in the herpes family. So any of those herpes viruses like simplex 1 and 2 or like chickenpox, mono, all of those go latent and are stuck with for life. This one particularly tends to cause extreme fatigue, sore throats, a lot of aching and pain and fever. But the crazy and scary thing about EBV is that it can also cause problems down the line. So they are now finding that it tends to cause chronic fatigue syndrome, and more scary is the fact that it has also now been linked to cancers down the line. So you think, oh, it's just mono, just kissing disease, every college student has it, and then boom, down the line, you end up immunodeficient or with cancers, because what EBV does is it goes latent in your B cells. So it's replicating in your B cells and then ends up going latent in a population of the B cells. And so down the line, you could end up immunodeficient and with B-cell lymphomas or with nasopharyngeal cancer, because as you know, it tends to focus on your throat region when you end up infected. So even things like kissing, you have to be careful of as well. Don't take these things lightly and never take any infection lightly. Again, you get these things from people who are not even showing symptoms, and then boom, down the line, you have cancer or big time problems like chronic fatigue. Now, before wrapping up, I do want to mention some fungal infections and then parasitic infections, even though you may not be encountering them as much in, let's say the media and whatnot. So the big issue in terms of fungal reproductive or sexually transmitted diseases are vaginitis and urethritis. Specifically, the issue is Candida albicans. So there are different types of yeast. Saccharomyces cerevisiae is the fun one with beer and fermentation and making breads and stuff. Candida albicans is the very pathogenic form of yeast or example of yeast. And what's funny about this yeast causing infections or sexually transmitted diseases is Candida albicans is actually a normal flora in the vagina. And when people think of yeast infections, they of course think of females, because Candida is normally in the vaginal region, and certain things can trigger its overgrowth, and they end up with this very itchy, irritating discharge and whatnot. And so females can actually have yeast infections even if they are virgins and not sexually transmitted. Even some women tend to get them, especially around their menstrual cycle. So once a month, even they'll suddenly have some of the irritation if it's not, maybe at its worst. Also, things like tighter clothing and warmer summer months can also trigger it, because again, if you think of fungal growth, they like that warmth, moisture kind of condition, and so the vaginal area tends to be a perfect breeding ground for them. But the very interesting part about yeast infections that most people, especially males, do not realize is that yeast infections can be sexually transmitted, and men get them a lot as well. In men, when they get that Candida albicans transferred to their penis, they end up with an infection called balanitis. And balanitis is inflammation or infection of the tip of the penis, which produces major discharge, pain, itching, and dysuria, which is that burning, painful peeing sensation. Okay, so please keep in mind that when you see the term balanitis or when you see Candida albicans, that Candida albicans and yeast infections are not just for women. They can be transmitted to men who then have the inflammation and infection at the tip of their penis called balanitis. And they then, whether it's male or female, end up needing an antifungal drug to help take care of this. And I do want to point out that since it is sexually transmitted, you also end up with the possibility of oral transmission. So again, oral sex can end up creating in the male or the female an overgrowth of yeast in their mouth. And so you can see all of these mouth pictures, tongue and the roof of their mouth and all, even toenail area in this one. But you end up with that overgrowth depending on where the yeast ends up. Okay, so again, infections are not picky about where they're going. So think about this in terms of being careful with your sexual practices and who your partners are. The last traumatizing little thing I want to mention is that parasites can also be sexually transmitted. The parasitic infections are arthropod infestations. So things like Thyris pubis or Sarcoptes scabiei, which are pubic lice, being, if you've ever heard of crabs, most people have heard of it, or genital scabies, and both of these produce incredible amounts of itching and irritation in the genital region. And again, without getting too visual, one of the interesting things is even with the arthropod infestations, so things like crabs, lice, scabies, any of that can be transmitted to other parts of the body, so even on eyelashes. So again, not getting too visual or graphic, but during sexual practices, you know, it's not just genital to genital encounters that will cause transmission of these different infections. And so these are what these lovely guys look like. You can also, in this case, this is the eyelash infection, where you can see the eggs and the larval infestation, and you see the blistering that they cause. And I want to point out that some of these, especially scabies, you don't end up just with genital infections, but whole body infections are very common with scabies. They're actually hugely common in nursing homes. Again, not going into details, but think about it. These people have a lot of time on their hands, and not just their hands. But anyway, when it comes to these kind of infections, you have to be careful, you know, where you're going, what you're doing, and they are very, very problematic. And then a lot of times lice and scabies, they're treated with things like permethrin shampoo, which then paralyzes and kills the mites and the eggs as well, because it's very important to kill those eggs and get rid of the infections. So now that I have thoroughly traumatized you and made you kind of happy if you never leave your home again or ever encounter people again, it is now time for you to head over to the discussion board and please post some questions and answer some questions from your classmates as well. As always, if you have any questions or concerns, let me know in the Remind app. Thank you and have a great day.